Hi everyone. In this narrated presentation, we're going to go over the trans-theoretical model of behavior change, or more commonly referred to as the stages of change. The stages of change model provides the framework for behavior change counseling, one of the most important and influential skills you will use as a community health worker. So what exactly is behavior change? Behavior change in the context of public health refers to efforts put in place to change people's personal habits and attitudes to prevent disease. Behavior change in public health is also known as social and behavioral change communication because it really is a communication skill. So why is it important for health? We want to help support people make the decisions that are important to them, that are going to make them feel more healthy and have a greater sense of well-being. So how hard is it? It is difficult. Any change is hard, especially when it's something as personal as decisions that affect your health. So how can we help? We can help people by setting goals and looking to move them from one stage to the next. You don't necessarily want them to bite off more than they can handle at one particular time, so step by step is a really good way to look at it. The stages of change model is comprised of 6 stages: pre-contemplation, contemplation, preparation, action, maintenance, and relapse. This model is represented as a cycle because we understand that behavior change counseling is a non-linear process. It's important to note that your clients could exit and re-enter this cycle at any stage, and that if they have different health behaviors that you're addressing, they will have a unique cycle for each one. This is important to consider. In the pre-contemplation stage, the client denies a problem. You want to encourage them to consider the short and long-term consequences of their behavior. Where you'll commonly find people in the pre-contemplation stage is if you're going and doing an activity such as street outreach or something else where you're actually physically going and meeting people where they are when they don't have knowledge of what you represent and what you're there to help with yet. This is because when you're coming to them and discussing one of their health behaviors, they haven't necessarily taken ownership over that change process yet, so they haven't necessarily even begun thinking about it. In the contemplation stage, the client feels uncertain and has conflicting emotions. They're aware of the risk and potential benefits of changing. So for you, continuing to provide help in weighing the pros and cons and providing encouragement and the ability to change will help find a way to break through some of these barriers. Where you'll often find a client in the contemplation stage is when they're first coming to meet with you, either in a health center or a community-based organization. This is because they've begun to take ownership of the change process by taking that first step to do something about it. This is a great time for you to think about affirming that decision and starting this relationship off with a strengths-based perspective. In the preparation stage, the client expresses readiness to begin the process. This is the first active stage. Begin trying small changes and collecting information about change and recovery. You want to encourage them to write down their goals, prepare a plan of action, and make a list of motivating statements. Don't push them too far to do too much action. Just prepare and get organized and get comfortable with the idea of doing something about changing. In the action stage, the client is ready to take direct action towards achieving a goal. They need clear goals and specific long-term action plans to be successful moving through this stage. For you, you want to praise or affirm the client for any positive action taken to get here. Provide continued encouragement and think about rewards for successes and continue to reinforce that plan of action through recognizing their progress. Regularly review those motivations, resources, and progress to continue to help someone move along in this stage. In the maintenance phase, the client focuses on creating new patterns of behavior. You want to try to help them stay away from places that trigger habits by creating plans focused on prevention. You can also help them learn to incorporate new behaviors into long-term identities, goals, and activities. Help make the next recovery last longer, and as always, keep them in the driver's seat. In the relapse prevention stage, you want to be aware that relapse is common. Use relapse to help reinforce lessons and move back to recovery plans that have been successful in the past or look forward to self-directed plans that may be successful in the future. Encourage your clients not to give up, normalize the risk of relapse, and continue to provide support and resources for their success.